FDA is out with a new warning for seniors. New research shows seniors who get a COVID and flu shot together at the same time may be at a slightly higher risk of stroke. Although a lot of experts are questioning how the study came to their conclusion, and they say getting the shots at the same time, still a safe thing to do. Oh, that just makes me confused. So why don't we bring in a UW Health doctor joining us to talk about this and other health headlines. Dr. Bill Hartman, clinical trialist at UW Health. Great to see you, Doc. Walk us through the new study that just came out.
Right. So what they're seeing is that in the oldest people who've received both the COVID-19 and the flu shot in this FDA-funded study, the only one like it so far, actually, but they're seeing a slight increase in strokes in the oldest people who get both shots at the same time. It's really difficult to discern whether or not the signal is true or not. I still think the benefits far outweigh the risks of the shot, and it's still an okay thing to get both shots at the same time.
And I know we're talking specifically seniors here in this research, and the research looked at people 85 and older. I mean, they're at risk of stroke, a higher risk of stroke, if they don't get vaccinated and then they get the flu or COVID, right?
That's true. Their risk of having a stroke is already baseline higher than the general population. We don't know. That doesn't get teased out in these studies. And the other thing is, too, when you get a bad flu or when you get COVID-19, you also have an increased chance of developing a stroke. And so, again, it's 6 of one, half dozen of the other. I still think it's safe to get both shots at the same time.
If you had any concern, though, should you just maybe separate them out? And if so, I mean, how much separation would even lower the risk, if at all?
So I do think that if you have any concerns, if you're worried about it at all, absolutely go ahead and separate the shots, separate them by about 10 days or so. It doesn't matter which one you get first. Do you lower the risk of the stroke? We don't know. Those studies haven't been shown. But hopefully it would get back to, or the data would get back to the baseline showing that these are just safe, effective, and safe for everybody.
Interesting. Hey, let's talk about sickle cell. More good news for people who suffer from the terrible disease. The UK has approved the first gene therapy treatment. This is a game changer, kind of shown to eliminate severe pain. Is this a sign it could soon be here in the U.S.?
So this is one of those things where you're like, this is one of the coolest things I've ever seen. The technology, the CRISPR technology, won the Nobel Prize in 2020, and it's this gene editing technology. And so in London, 29 people had stem cells removed from their bone marrow. They were edited for these hemoglobin genes in either thalassemia patients or in sickle cell patients. It corrected the mutation, and 28 of 29 people have had a response so good that they've had no hospitalizations, no increase in pain. So we're seeing something that we didn't think that we would ever see in our lifetime.
And that's why we love bringing you on to talk about the good things that are happening in the medical field. Dr. Bill Hartman from UW Health, appreciate your time.
Thank you very much.